The most common misconception about arthritis is that people don't realize that it is a serious, deadly disease that kills many people, and they die from this disease, and it gets attributed to a heart attack or to they just got old, or they don't realize that it was a systemic cause of this autoimmune disease that killed them.
That it's a disease of the old. I was diagnosed with arthritis or juvenile idiopathic arthritis when I was 14, and so I just struggled with it as an adolescent and growing up into an adult, and sort of making my way in the world. A lot of people think it's just something that your grandmother or your grandfather will get, but it does affect people like in the prime of their lives or even beforehand, like in the case of myself.
With the inflammatory arthritis, the lifespan is, the average reduction is by about 10 years. And I don't think many people understand that or know that that's the shadow we live with.
I saw my doctor speaking in a public forum, and he said inflammatory arthritis is a medical emergency. And so when I meet people and I say, oh, I've got rheumatoid arthritis, they say, oh, I've got arthritis too, see? And they don't understand that there are different types of arthritis, and that you can actually be, your life might be substantially shortened through having rheumatoid arthritis.
It's a lot more than just the physical. It's everything else. It's the social, it's the psychological, it's the mental health. It's a whole component, and people, they forget about that.
I think the most common misconception about arthritis is that it's something that only happens as you're aging. So it's a natural aging process. Only old people get it. It's just wear and tear of your joints. And I think people don't realize that that's not actually the case for inflammatory arthritis, and that it's a very systemic disease that affects many organs, not just your joints. And it actually affects many aspects of your life as well, not just your joints again. So I think that's it.
And it's so much more than joint health. It's every aspect of your life. It affects your living, your income, your mental health, your social aspects, all parts of, it affects your life that way.
I think one of the biggest issues, and I think CAPA's just started a new project called Pregnancy and Parenting with Arthritis, and it's about having, wanting to have a baby and wanting to have a child, and then worrying all through the pregnancy and trying to take care of that child.
Find out that some of the medications aren't actually studied in pregnant women, or in in terms of breastfeeding. We're all told that breast is best, and then suddenly to sort of find out that, oh no, they haven't actually studied it. There isn't a lot of good safety data in terms of the safety of the medication. So you end up taking risks, right? And I think that's a uniquely, female or something that affects women.
As a professional woman, we work twice as hard to get to the same place. When you have a chronic condition, that just adds to your burden. And because the disease affects more women than men, there are just so many women out there, running twice as fast. Now they have to run 4 times as fast in order to keep up with the standards. And workplace accommodation is still not common.
Well, I think one thing that applies as people are aging is that generally you see a lot more women who age and live longer. And so when you've got a chronic disease that affects your abilities to do your usual household tasks, it means that you're not going to be independent as long as you would like to be.
If you're a woman who has arthritis, who has kids, it's the ability to keep up and do all the things that you'd love to do and you see all the other moms doing but you can't do. And dealing with that, right? And coming to a place in your head where you're comfortable with that, but it's where you're at.
Unless you're living with the disease, you really don't understand what it's like. And so sometimes it can be very isolating because you might have a supportive family, spouse, and friends, but again, they really don't know your day-to-day struggles, and adding that on top of just having issues with mobility and trying to get them to help you in that sense, what's going on in your head is just a whole nother kettle of fish that's really difficult for a lot of people.
My children were older when I got arthritis, so they, for them, there were big changes because they saw Mom when I could ski and canoe and bike and hike and all that, and then they saw, you know, the after effects, and my life changed. So, you know, it was hard for my children as well. So.